Good afternoon, everyone. My name is Osama. This is Rami, and unfortunately, John couldn't make it tonight. Our company's name is AMNA, and we're looking to solve a complicated problem with a simple solution. So a few weeks ago, I was working in the emergency room, and we had 3 different patients come in one day, all for overdoses. I noticed that the resident was counting the pills in each bottle for each patient because she was trying to figure out how many pills the patients had taken. So I looked at that, and I realized, why don't we just restrict the amount of pills that a patient could take so that we could prevent an overdose before it even happens and prevent addictive tendencies before they develop. And so just a quick overview on the issue that we're trying to tackle. Overdose has risen dramatically in the past 2 decades. It hit 70,000 deaths in 2017. And 40% of these deaths are attributed to prescription pills. So that includes opioids, stimulants, and several other types. So the device we designed is a pill dispensing device. It has a small opening on the top that dispenses 1 pill at a time using a turning mechanism on the inside driven by a motor. On the bottom, it has a refill input that is only accessible by a pharmacist so that you could refill whatever drug they're using. It also has counters, one that tells you how many pills are left and one that tells you how much time is remaining until the next dosage. And it's activated using the button in the middle that triggers the turning mechanism. It also has a light and sound reminder for Alzheimer's patients that may forget to use their medication or that may use it several times because they forgot they took it in the first place. The market we're after is a $9.2 billion market comprised mainly of opioids, but it also includes antidepressants and stimulants, which also pose an addiction risk to the patients who use them. Our business plan is to first target drug rehabilitation centers, where we can work with nurses to facilitate the use of the device. Next, we'd like to partner with inpatient and outpatient facilities where physicians can prescribe the use of the device at home for patients to use after they're discharged. Finally, we'd like to roll out into retail pharmacies where the patients could pick up the device from a pharmacy very easily. Finally, our competition. There exists no solution on the market currently for abuse prevention. Any smart bottle that exists right now only works to remind a patient to use to take their medication, targeted towards Alzheimer's patients. So the one on the left costs upwards of $400 a year. Again, only reminds the patient. The one in the middle, just a timer. So there exists nothing that is relatively cheap and can still use and still can prevent overdose. Our design would cost about $50 to produce, and it would retail for up to $100. Any questions?
Who would be covering the cost?
The insurance companies. And that's a great question because as one of the groups highlighted earlier, actually, an emergency department visit for a simple overdose can cost upwards of $5,000. So covering the cost of this $100 device is an investment to avoid a $5,000 cost.
And why is retail pharmacies the last? Wouldn't that be where most are getting the prescriptions?
Right, absolutely. But in order to prove that it works, we would want to work first with people that we know need the device before. Yeah.
I guess if you're working with like rehab centers, I mean, wouldn't they already know this? Like it wouldn't be blocking the physicians because they already know how much medication they need to provide. It's not like the patients are pouring their own medications out within those facilities, right?
Right, but after they're discharged, that's the idea. After they're discharged, it would.
I have kind of two questions. One is, where does AI fit into this? And secondly, is a device hammer-proof?
AI fits into the predictive analytics where we can see, okay, has a patient overdosed in the past? Do they have a family history of overdosing? Is the drug that they're using, is it a risk? Does it pose a risk of addiction? So all of these should be in the patient's health records, and they should be compiled in order to find out whether this patient does in fact need the drug. As for your second question, no, it is not indestructible, but the idea is that there's a lot of patients that are prescribed opioids, for example, after a car accident, that are great people, educated, never meant to overdose, but opioids are so dangerous to the point where they force really well-meaning people to overdose. And so the idea is that you want to restrict the usage of these kind of drugs before addiction even develops, and so that you could protect against people having the tendencies to break into it. Thank you.